Hello, dear MPS scholars. My name is Dr. Siddharth Sharma. I am a spine and pain physician, and in this video, I'm going to tell you about the NMC Recommended Pain Syllabus for anesthesia postgraduate students. So, you may be studying in any country, but for post-graduation, pain medicine forms an important part and parcel of your curriculum. Before we go ahead, please click on subscribe for this channel and also click on the bell icon so that you can get all the notifications for all the latest videos from the Mumbai Pain School. So let's begin. So this is going to be a talk on the NMC recommended pain syllabus for anesthesia postgraduate students. And even if you have recently completed your MD anesthesiology and probably you've not been taught so about the pain syllabus, you're not knowing and you have interest in that. So I think this video will help you a lot. So about myself first, I am Dr. Siddharth Sharma. I am Associate Professor and Mentor for Fellowship in Pain Medicine at the Pain Medicine Unit at one of the popular medical colleges of this region, that is D.Y. Patil University School of Medicine. And also I am a consultant spine and pain physician at Panisha Spine Wellness and Pain Relief Center in Mumbai. You can connect with me using these links. So Mumbai Pain School is an initiative by Panisha Spine Wellness and Pain Relief Center in Mumbai, India. So if you open the NMC website and you can just find the syllabus which is given for MD anesthesiology and also recommended for most of the training programs in the country. And this includes the subject specific competencies in the cognitive domain. So that means the knowledge of anatomy related to the blocks for acute pain states, physiology for central autonomic and peripheral nervous systems, postoperative care in the recovery room in terms of management of the pain, acute pain management, chronic pain therapy and therapeutic procedures, and even the non-conventional methods of treatment like the acupuncture and acupressure are also included in the syllabus. Care of the terminally ill, hospices management, and do not resuscitate orders also form part of the syllabus. Now, in the skills, that is the psychomotor domains, the student who passes this course is expected to demonstrate the ability to observe, recognize, and treat the commonly occurring problems in pain prevention and pain relief. So there is a host of problems I have just pointed out on the pain portion of it. So pain prevention and pain relief forms a part of it. In addition, the acute and chronic pain management, different capabilities have to be possessed by the candidate, which include history taking, physical examination, interpretation of investigations, classification of pain, with basis on the duration of pain, also the etiology of pain, and the knowledge of pain pathways in detail. The student should also be able to practice the different modalities of physical therapy. So that's very important. So you are supposed to know the physical therapy as well. Then practice the acute pain, cancer pain guidelines, and WHO treatment ladder. Practice the route of administration about the risk benefits of the drugs used for acute and chronic pain relief. And also practice the patient control analgesia, which is also known as PCA, and treat the common pain syndromes. You should be able to demonstrate the practice of pain management in patients with problems of drug use, dependency, and addiction, and also identify parameters which involves the referral to a pain medicine specialist. In addition, the acute pain service organization, role of the acute pain nurse in various groups of patients, physiological changes of pain which are secondary to pain, and different modalities of pain control must be known. Pharmacology of the opioids, that is opioid analgesia or non-opioid analgesia, principles of PCA I already told you, and the assessment of its efficacy, pharmacology, and side effects of the epidural intrathecal opioids. So the opioid usage must be known threadbare. The neurological assessment of epidural blockade and management of a failed block, which is also routinely taught, is also mentioned in the syllabus. Management of regional blockade, that is the regional brachial plexus, paravertebral, intrapleural block, and also management of one of the complications, that is the epidural abscess, is mentioned exquisitely in the syllabus. Substance abuse and acute pain control, also pain control in the concurrent medical diseases like COAD, ischemic heart disease, bleeding tendencies, geriatric age groups, burn patients, trauma patients, including multiple rib fracture. So this is all recommended in the syllabus. The demonstration of abilities to manage chronic pain, these include the knowledge of physical therapy, psychotherapy, neuroablation, that is all the radiofrequency, cryoablation, all procedures are included. Neuroaugmentation means the augmentation procedures like the vertebroplasty, and also the spine endoscopy and other procedures, spinal opioids, interventional neuroblockade, non-opioid analgesia, everything is included. Anatomy, indication, techniques, and complication of chemical sympathectomy, which is also included. So here they didn't mention the chemical, so they have stated it separately as well. Also, although ablation can be done with chemical methods also. In addition, principles and management of cancer pain, non-cancer neuropathic pain like phantom limb, postherpetic neuralgia, CRPS, trigeminal neuralgia, etc. are also mentioned. The non-cancer nociceptive pain like the myofascial lower back pain, intractable angina, burns, chronic pancreatitis, peripheral vascular disease are also mentioned clearly. You should be able to practice epidural steroid injections at all levels, and this is not for anesthesia alone but pain relief as well, and long-term epidural catheterization. You should be able to observe and practice the following blocks, that is infraorbital nerve and intercostal nerve blocks. Continuing the demonstration of abilities to manage chronic pain, you should be able to recognize the complication associated with each of these procedures and know these treatments. And also techniques like TENS, that is, these are the electrical therapy. So TENS is a very simple therapy, but also dorsal column stimulation, which includes the spinal cord stimulation and deep brain stimulation. So here they have mentioned about neuromodulation. Then the mechanism and side effects of other therapies used for treating pain. So as other word is there, so you can construct that whatever newer modalities will come, they'll be posted here. The principles of pain management in the special patient groups, as earlier also, the syllabus focuses specifically on the needs of the elderly, children, disabled, intellectually handicapped, and those who are unable to communicate. Awareness of the principles for insertion and management of implantable drug delivery systems, that is the intrathecal pumps. So these are extremely important and also mentioned here. Awareness of the basic principles of palliative care, that is the basis of the palliative care, must be known. Now coming to the suggested time frame for the training of the PG students. For the first 6 months, there is only one mention of the physiology, which is which is to be studied, and that is a theoretical skill. For the next 18 months, the pain clinic posting is there, which is recommended. And the last 12 months should be the patient, the postgraduate student should be able to treat intractable pain. At the end of the 3 years, they should have skills to manage intractable acute and chronic pain both. So for the first year, the syllabus mainly focuses on physiology related to CNS and PNS. Then the second year, the focus is on palliative components, cancer care. And the third year focuses on the most important part, which is the chronic pain therapy and therapeutic nerve blocks, acupuncture, acupressure, other non-conventional management methods. Pain clinic is one of the 7 areas where the posting of the postgraduate anesthesia students is recommended. The suggested schedule of the operating theater can be, the posting can be pain clinic for at least 1 month, it is suggested. The examinations, as we know, consists of 4 papers of 3 hours each, having 10 short questions with 10 marks each. So the basic sciences is the same. However, in there is some changes in the next few papers. So if you see that anesthesia in relation to subspecialties and super specialties has been mentioned, so pain medicine can come here as well. And in addition, there is a mention of pain medicine as a separate specialty in paper 4. So this is extremely important to understand. So in the recent advances, they have added intensive care medicine and pain medicine. In the recommended list of books, I could find the Practical Management of Pain. So this book was written by Prithviraj originally, but nowadays, which is what is mentioned in the syllabus, but nowadays this one is available, which is the 5th edition of Practical Management of Pain, which is available in the bookstores, also at Amazon. So the secret of getting things done is to act. This was the syllabus, but we have to study all this as the anesthesia postgraduate students, and I'm sure there'll be a lot of lacunae in the teaching, but we are here to fill the gap. So just join our mailing list, the WhatsApp or Telegram group. The link will be given to you, and stay tuned for the future events. And of course, some of you will be doing the PG Pain Pro program after this. So please log into your live lectures, and just for reaching out to us, please mail us on mumbaiPainSchool@gmail.com, and comment below and just tell us how you like this video, what you like to cover in the future videos which we make. And I think that's it from our side. Um, keep me posted about what you think through your emails, your communication, and hoping that you you have a good time reading. Wishing you a very, very, very happy learning. Signing off.